Breast cancer is the second most common cancer among women and the second leading cause of death among women in the United States. For non-Hispanic Black women and Hispanic women, breast cancer is the leading cause of cancer death. Affinia Healthcare talks with 3 staff members as they share their personal story of being diagnosed, receiving treatment, and winning their battle with breast cancer. In this second video of a 2-part series, we discuss the method of treatment the women chose and the advice they give to others.
I was pretty knowledgeable of chemo, radiation, side effects, things that happen with your cancer diagnosis and progression. So I wasn't nervous because I think most of the patients that I've taken care of was kind of half and half. Half of them did very well getting chemo and radiation, and the other half did poorly. So that really didn't give me which way I would fall, which category I would fall in. So I just kept my fingers crossed and went through with the chemo and the radiation, and I'm just going to deal with it one day at a time. That's all I could do.
I had chemo, and I had radiation as well. And I had another medication called Herceptin because they did the BRCA gene on me. They came back negative. But they still gave me some Herceptin for like a year. So I, of course, lost my hair, So, but yes, I went through the chemo and radiation.
So I ended up having chemo. And then I had the breast surgery. I had mastectomy on the right, and started radiation afterwards. And probably about 6 months later, found cyst on the left side and ended up having another mastectomy. So I ended up having a double mastectomy within a year's time. And so it was a pretty amazing course.
Spiritual faith, a strong support group, and staying positive helped these 3 women get through tough times.
You soon learn to take your rest days when you can. Look for the positives daily, every day. Look for something positive to deal with and to look forward to. And let others do for you, help you. That was the hardest thing for me to do. Being a nurse, I'm used to being in control and taking care of other people, including your family, your children. But, you do have to relinquish some of that.
Have a good support system. Take someone to your doctor's appointment with you. Ask lots of questions so you can get an understanding. Even though you are afraid, still do it afraid. If you have any relationship with the Lord, lean on that in your church members, but do it afraid because it's not a death sentence.
And I thought, Lord, I'm not going to pass away from this. So whatever it is I needed to do was my course of treatment, then I was going to adhere to it. So.
Thank you to our staff, Giovanna, Trina, and Don, for your transparency and willingness to share your experience with others. Affinia Healthcare partners with BJC Healthcare to provide mammograms to our patients. To find out if you're eligible, please call 314-814-8552.